Well, if you've been watching the news lately, you know coronavirus cases are on the rise here in the Gem State. 644 cases added to the state's total yesterday. And today, the governor said, we're staying put. Idaho will remain in stage 4 of restrictions for at least the next 2 more weeks. Our Katya Stepovic has the latest from today's news conference. Katya, what'd you find out?
Yeah, Mark, definitely the news we didn't want to hear today, staying in stage 4. But the reality of the situation is our day-to-day case counts, they're just too high, and we have to stay put. Now, the governor talking today about his plan with the federal government on distributing a COVID-19 vaccine when that becomes available. He also talked about some new testing that will soon be available to schools in Idaho.
Many parts of the state are seeing these increases. And we are concerned with fall coming on, more people in school, more people inside, that we will continue to struggle with rising case numbers.
As schools continue to open for in-person learning, cases are on the rise, especially in younger age groups. On Thursday, the governor announced Idaho has received 530,000 rapid antigen tests. Teachers and staff will be the priority. The governor hopes the move will keep students in school.
This will be a game changer for schools. The new rapid tests help quickly determine who has and who does not have COVID-19, so teachers and students can be back in their classrooms instead of quarantine.
We want to make sure we can keep those schools open. They can't operate if the teachers aren't there or the staff aren't there. These tests were designed for symptomatic or sick people. That said, the federal government has given us allowance to use it potentially for surveillance or asymptomatic.
The tests will be delivered throughout Idaho over the next 3 months. 35,000 have already been shipped. State epidemiologist Dr. Christine Hahn says one of the biggest hurdles in getting back to normal will be getting a safe and effective COVID-19 vaccine.
We need to work hard doubly hard to communicate not only to the general public about this vaccine, for which there is, of course, concern about safety and efficacy. Concern is it being pushed out too quickly. We need to not only stay informed ourselves, but communicate, first of all, to our healthcare providing community, our doctors, our experts in vaccines around the state.
Dr. Hahn said adult frontline workers will be a priority in getting the vaccine when it becomes available. The governor says a new Idaho COVID-19 Vaccine Advisory Committee will include health experts from around the state. The committee will submit their vaccine rollout plan to the CDC on October 16th.
As dropping temperatures drive people indoors, we will likely continue to see an uptick in spread across the country. This only reinforces the need for all of us to ramp up our personal actions to slow the spread of coronavirus and keep our kids in school, our loved ones safe, and our economy open.
The governor says there will be no mandate on getting this COVID-19 vaccine. He thinks more people will feel inclined to get the vaccine if they're not forced to do so. But both him and Dr. Hahn today stressing the importance of getting the flu shot. They say getting your flu shot right now will just help not overwhelming our healthcare system. Mark?
Obviously, with the numbers we've seen, there was really no speculation that we would be moving out of this current phase. He confirmed that today. Katya, thank you.